We're really just on a mission to keep people out of hospital.
I know that there's someone at the end of the phone that I can call to get something changed or fixed or done, which gives me my life. So having them there, it helps me get up earlier and get out and about.
Without them, I don't know if we'd be around, to be honest with you. It's really, really important to just have that empathy with someone.
A lot of people, when they're first injured, find it very difficult to deal with the injury.
You tend to lose your sense of identity. You're just a patient in that bed in the ward, and the doctors gather around and talk about the injury.
During that time, it was very traumatic and hard to know what exactly was going to happen.
icare identified the needs to be able to provide a better service to these people, more available, less waiting time, and to be able to try and improve their quality of life.
And so to have this organisation be so supportive was incredibly helpful financially, practically, medically and personally.
Being there and being able to talk about it is one of the best things, and that's something that I found was great.
Just interacting with people is very important. You can't just live alone all your life. It gives me something to look forward to a couple of times a week.
By introducing me to adaptive photography, this has led me to new environments and new landscapes. That sense of independence really allowed me to improve my quality of life.
I have a hand cycle which icare purchased for me to allow me to get out and do some exercise. It allows me to continue my life, because without my chair, I wouldn't be able to do anything.
You could see the passion in the group. They were fighting to ban asbestos and to help people who are affected by it. The medical facility at icare in Pitt Street is just beautiful. They have every type of equipment you need for asbestos disease.
So there are about 10 million wheelchair users globally in developed countries. And our mission is to enable all of those wheelchair users, every one of them, to take charge of their health in everyday life.
It really helps knowing that someone is there to talk to and that they are quite free and willing to help me out with everything that I need.
If we're achieving those rehab goals with the participant and their quality of life's improving, our support is often reduced, which is fabulous, because we're seeing that the people are actually being able to manage independently, tasks that they couldn't previously.
We've been given tremendous support to bring him to the greatest capacity of independence possible, and that's been so valuable.
Since leaving rehab, I can definitely say that my quality of life has improved drastically.
Our future plans are, well,
icare has helped with a return to work program. Since the accident, I've seen how much care and support has been given to me, and I do want to contribute and give that care back to people.
We're becoming more social again, we're becoming more involved in our community.
icare gives me life in the way that everything that I have now will continue.
The impact we see takes time. It's not a light switch. You don't see somebody recover from one day to the next, but it's lovely to be able to see them integrate back into their families and live, as either a wife again or a husband again.
I think the objective is to live as normal a life as possible, and in the old days normal life might have sounded a little bit uninteresting, but these days normal is very, very exciting.